Welcome back to another edition of the Colander Medical Radio Show. I'm your host, Anne-Marie Cronin, here talking with Dr. Brian Colander, board certified in internal medicine and specialist in artery disease, with offices in Bingham Farms in downtown Detroit. Dr. Colander is here with us discussing his concierge practice and how to avoid heart attack and stroke, and how to begin the reversal of artery disease. Now, Dr. Colander, it's all very interesting. I know that you have said in the past that it is 100% avoidable and preventable heart disease and stroke. And we're going to be talking tonight about some of the measures you use, the tests that you take. And we're going to start off with cholesterol and what are the misconceptions and preconceptions of the role of cholesterol. And first of all, what is cholesterol?
Well, thanks, Anne-Marie. Again, I want to welcome back our listeners and welcome our new listeners and remind everybody that what we're here to do, as Anne-Marie said, is to educate everyone how to prevent heart attack and stroke, because our current healthcare system is not doing a good job at that at all. And the science and testing and treatments are available to make us all heart attack and stroke proof. So as you listen to these shows, we are going through a lot of sometimes complex areas. I invite you to go on YouTube. You can go to our YouTube channel, Colander Medical, and re-listen to some of the shows that you might find interesting, and because you may miss a lot of things that we're talking about. So cholesterol. Cholesterol, although it sounds like a bad word because it's associated closely with having a heart attack or stroke, the first question people want to know is, well, what's your cholesterol? Our body uses cholesterol to make a lot of things. Cholesterol is a background molecule that's used to make hormones. So our adrenaline, our testosterone, our estrogen are all used from a base structure of a cholesterol molecule. And then some of these molecules are made into cholesterol products that are made in the wrong way. And some, we hear about good cholesterols and bad cholesterols, and the bad cholesterols get involved in vascular disease. So what I want to start with is re-educating people on, or I shouldn't say re-educating, let's talk about some of the misperceptions people have about cholesterol, because people know a little bit. You know that you may or may not know that LDL, which is your bad cholesterol. I'm not going to get into the acronyms, or should I, Anne-Marie, talk about what all these things are?
Well, first of all, I'm still trying to figure out what cholesterol is,
right.
And why is it high in certain people, and why do they genetically inherit, the predisposition of high cholesterol, or is it what we eat?
Well, we're going to talk about a couple genetic cholesterols in the next segment or two. Mm-hmm. But for the most part, cholesterol is environmental. Yes, there's some genetic components, but they're not that. Some are common. Actually, one very dangerous cholesterol particle is common, and that's coming in segment 2 or 3. But the average cholesterol that we have is very dependent on lifestyle, how we eat and exercise. So it's very important to live a healthy lifestyle. And that's our number one tool for preventing heart attacks and strokes is lifestyle. But I know half our listeners or so are saying, well, I've got a very high HDL. HDL is high density lipoprotein, and HDL is your good cholesterol. And I'm going to put in quotation marks, good cholesterol, because it isn't always good. And it frustrates me because a lot of doctors tell their patients, well, you're going to be fine forever because you have a good HDL.
What does good HDL mean? Are there number values?
HDL, an average HDL is maybe 50, mm-hmm. and a low HDL is in the 45 or lower. High HDL, there's no high enough HDL, but I'm saying that, and also I'm going to contradict myself in the next sentence and say, we really do not understand how HDL works completely and how it affects us. So it's not fair to hear as a patient that I've got good HDL because your doctor tells you it's good and you're fine. The problem is it may not be fine, and you're being taken off the alarm. You know, when your doctor says, hey, you're going to be great, don't have to worry about your heart because you got a good HDL, that's just not true, because HDLs take cholesterol out of your arteries and move it to your liver. And it's supposed to be, that's where your cholesterol is supposed to go, to your liver to make things that your body needs. But what if your HDL is high because your liver's not good at unloading the HDL? You know, what if your HDL is low because your liver's good at recycling the HDL, and that's why it's low? What if your HDL's, you know, not good at picking it up, but good at emptying it? There's just so many permutations that make the absolute value of HDL difficult to understand. So what really matters is how your HDL functions, and we don't have tests for that yet.
So that would be more of a genetic thing, I guess.
No, it is not. It is not. These things are also adaptable by lifestyle. But I want to say that for the first segment right now, you cannot go by, my doctor said my HDL is good and I don't have to worry about it. You need personalized care.
Okay. Well, we're going to have to pick back up on that after the break. In the meantime, you're listening to the Collender Medical Radio Show. You can reach Dr. Brian Collender by calling 248-737-0091. Again, that number is 248-737-0091. You're listening to the Collender Medical Radio Show on News Talk 760 WJR.